Many times that it's important that every single one of us do our part by masking up and fighting this virus, and that it really has to be a team effort where we're all on the same team. As you can probably see, the Lieutenant Governor has a U of M mask on. I brought my Spartan mask. But it's also why we've asked leaders from different universities in this state to come together, and people who know a little bit about teamwork to work with us to make sure that the public understands how important it is that we all wear masks. So with that, I'd love for you to take a look at this video.
As rivals, we don't always see eye to eye. Like who scored the best recruits? Who's gonna be who?
And whether we wear green
Or blue. But one thing we can all agree on, to help stop the spread of COVID-19, wear a mask. Wear a mask. Wear a mask.
wear a mask.
Wear a mask.
The ball's in your court, Michigan.
All right, so this is a part of our campaign to make sure everyone masks up. It's time to wear a mask. And some of my friends who were in that video are joining us today, so I'd like to welcome them up to the stage. All right. They're making their way up. A few of our coaches from two of our many universities, but two of our phenomenal universities are represented today. First, I would like to welcome Coach Susie Merchant, the coach of Michigan State University women's basketball team. Coach Merchant is entering her 14th season as head coach of MSU's women's basketball program, has nearly 500 career wins, bringing the Spartan program to the upper echelon of the Big Ten and the national level. She's also, she was an assistant coach with USA Basketball and helped the team win a gold medal at the World University Games. With that, I'd like to welcome Coach Merchant to the podium. Come on up, Coach.
Thank you, Governor. I appreciate that. Hello, everyone. First and foremost, I am delighted to be here today and just truly want to say to all the Michigan folks out there that today I'm here because we're not Democrats or Republicans. And today I also say I'm not really a Spartan or a Wolverine. We are Michigan people, and we're here to support our state, and we're asking each and every one of you, please, to wear a mask. I'm a mom of two little kids as well, and I spent about 3 months with them with online learning. So that was a challenge. I swore I'd never be a referee, but I felt like I was a referee a lot of times between a third grader and a seventh grader in between going back and forth with their school. So I can speak to you as a coach, as a mom, and certainly growing up in this great state, that these right here can help stop spread almost 70% of the time. And if we want our kids to be in school in the fall, we have to wear a mask. If you want to see college football this fall, we have to wear a mask. Okay, and that's what I'm here to support. So I just want to say thank you to you, Governor Whitmer, to you, Lieutenant Governor Gilchrist, for all of your leadership. Proud to be here and represent Michigan State in this great state. Thank you so much.
All right, good afternoon, everybody, and thank you for being here. This is a really important moment, and I wanted to just talk a little briefly about why this is so important, why it's important to me. As you may have heard me mention several times before when I've come to speak with you, that I've lost many people in my life to COVID-19. At this point, it's 23 to be precise, and these are real people. And I want to talk about one of the people who sadly has left us during this pandemic, and that was one of my basketball coaches, a man named Punch Martin, who I first met as a seventh grader when I was playing basketball, youth basketball in Southfield, Michigan. He was somebody who taught me to believe in myself and to be confident and believe in the skills that I had. That was teaching me more than how to, shoot a left-hand layup, more than how to dribble, more than how to box out, more than how to guard the post. He also taught me leadership, taught me life lessons. One of his most important sayings was to know your personnel, meaning that everybody has different skills and a different role to play on the team. You need to make sure you're putting people in a position to be successful. He showed me how to be a good person. And if we all take the steps that we have the control over, that we have the power to do, if we all are responsible and take actions like wearing masks, we have the ability to slow the spread of this virus. We have the power to save lives, and we can be in a better position to reinitiate those rivalries that are so important to us in Michigan. Wolverines versus Spartans. But please, now, I need everyone to step up and stand tall for Michigan. I need everybody to do the right thing and wear a mask. And now, again, I want to bring to the podium the winningest coach in Michigan Wolverines women's basketball history. The only coach in program history with 6 straight 20-win seasons. The University of Michigan women's basketball head coach, Kim Arico, here to the podium. Thank you.
Thank you, Lieutenant Governor, and thank you, Governor Whitmer, for having me here today. It's truly an honor to be here. Like Susie, as a parent, a mom, a coach, the most important thing for me right now is the health and the safety and the well-being of my children, all of our children, our student athletes, and our community and our state of Michigan. Regardless of if we live in Ann Arbor, East Lansing, or Northern Michigan, we are in this fight together, in this fight for Michigan. We would love, and I have 3 children as well, we would love for schools to open. We would love for our universities to open. We would love to play those rivalry games that you talked about. But we can't do that. We can't do that without all of you. We can't do that without everyone in our state wearing their masks and protecting each other and doing it for the state of Michigan. Masks matter. I think we found that out recently. Please, everyone, mask up for Michigan. We can do this. Thank you. And thanks again.
Thanks, Coach Arico. And now I want to introduce someone who probably doesn't need much of an introduction, but we're going to honor him with a bit of one. In his 25 years as head coach at Michigan State University, Coach Tom Izzo has compiled, of course, an impressive list of accomplishments, including the 2000 NCAA National Championship, 10 regular season Big Ten championships, 6 Big Ten tournament titles, 8 Final Four appearances, 8 National Coach of the Year awards, and a Big Ten record of 22 straight NCAA tournament appearances. Please welcome Coach Tom Izzo.
Geez, that sounded a lot more impressive than I feel. But, I too, honestly, I've never thought of myself in the political world. But when given this opportunity by our governor, I jumped at it. I just feel like, what we've been through and all the opportunities that have come, we need to make better decisions than we've made. The rivalries are one thing, and we all joke about them, and we laugh about them. And I just did a thing with Juwan Howard the other night for TV. Dwayne Casey put together a thing to try to help people understand how important this is. And in football, men's basketball, women's basketball, so on, both schools have had great success. But the fight against COVID-19 is not... It's not for just Spartans. It's not for Wolverines. It's for everybody to come together. And that doesn't happen very often. We're all on the same page. We're rivals. But in this case, I love everyone in this state. I've got to answer to 500,000 living alums, which isn't even close to what you got to answer to. But in doing that, I'm asking all the people in this great state, and I've lived here my entire life, to listen to the leadership. And I thought about leading by example. I kind of hate the phrase Because lead by example means that, although there's some people that don't lead at all by example right now, that bothers me a lot. But leading by example means you do the right thing. I think as leaders, we have to bring people with us. We just can't expect that they're going to see what we're doing. We've got to bring them with us. And so, with that being said, I decided to step out like both Kim and Susie did and try to be difference makers. And sadly, as we've all seen over these last few months, this common opponent is a deadly opponent. And outside of this 3-month stint, I've been proud to live in this state for my entire life. But I have been a little disappointed how some of the Michiganders have handled some things lately. There's no task that we can't handle, especially when we tackle it together. So I'm asking everyone to join me in wearing a mask, us in wearing a mask. I love that the governor said this: I don't care what you put on your mask, just wear something on your face. That was awesome. I really respect that, and I'd rather you not wear that silly M, but if you got to do it, you got to do it. But, although if you want to wear a Spartan mask around a neighborhood when there's a 7-footer around, I'd appreciate that too. But in all seriousness, from all of us, the bottom line is, let's all mask up for Michigan and show this country the state that really does work together and masks up together. So thank you for having me. Lieutenant Governor, thank you for having me. And let's mask up.
Thanks, Coach. Thank you. Thank you to all 3 of our coaches. Really appreciate all of you coming in and helping spread the word about how important it is that we all mask up. So with that, I think I'll be joined by Dr. Caldoun and Mark Burton, as well as the Lieutenant Governor. Got a number of things on our agenda. So we are at a turning point in our fight against COVID-19 in Michigan. Daily COVID-19 case counts now exceed 20 cases per million in Detroit, Kalamazoo, Saginaw, Jackson, and Upper Peninsula regions, and exceed 40 cases per million in Grand Rapids region. Research confirms that a big part of the reason is spotty compliance. That means that the requirement that people wear face masks is really important to get a handle on these numbers and to push these numbers down again. We've seen what can happen when people come together with face coverings, but we've also seen what can happen when people show up without a face covering. We have a choice to make. Do we double down and get more vigilant in our fight against this virus? Or do we let all of our hard work go to waste? All the hard work we've done over the past 4 months. Like I've said before, we got to be in the business of saving lives. That's what we're trying to do here. I'm working around the clock to ensure that the hard work we've done during this pandemic, that the hard work that made Michigan a national leader in our response to COVID-19 is not made in vain. So for the sake of our neighbors and for our loved ones and for our communities, for our heroes on the front line, for our kids who want to return to school in the fall, for our businesses that want to stay open or have the chance to open, it is incumbent on all Michiganders to do their part and to step up and mask up so that we can fight this virus. On Friday, I signed an executive order requiring mask use in all indoor public places. It also requires the use of face coverings in outdoor crowded spaces. It requires that any business that is open to the public refuse entry or service to people who refuse to wear a face covering, with limited exceptions. Because we know this, that wearing a mask, a simple act of a face covering, is one of the best tools that we have to fight this virus. A virus that is ravaging parts of our country right now and is growing here in Michigan. This isn't about vanity. It's not about comfort. It's about protecting our family and our friends and our loved ones from getting sick. Studies have shown that wearing a mask can save lives and significantly lower an individual's chance of spreading COVID-19. Masks can reduce the spread by about 70%. And by wearing masks now, we can put our state in a stronger position so our kids can return to school safely in the fall. I just want to look at this slide real quickly. You can see this is where we've been since March 10th, when our first 2 cases showed up, to where we are, to where we hope to be by September, when hopefully our kids are returning to school. You can see where we are now and what our trajectory is headed. If we don't do anything different right now and keep seeing our numbers climb, this is where we are headed. And as you can see, it'll be above where we were at the absolute worst time during COVID-19, or during the initial stay home, stay safe order. So this is what's at stake if we want to get our kids back in school and we want to keep our economy engaged. By wearing masks now, we can put our state in a stronger position. So the majority of Michigan schools are set to start on September 8th, with some even starting the week before. September 8th is only 55 days away. Now, for perspective, let's remember that 55 days with COVID-19 can dramatically show a huge increase or decrease, depending on what we all do. 55 days after we discussed our first cases of COVID-19 in Michigan, we went from 2 cases to 40,000 in that 55 days. More than 4,000 people died in that 55 days. That's all it took for COVID-19 to grow exponentially. If we let our guard down now, the next 55 days could look radically different than that initial outcome we had, or it could look a lot the same. Whether our kids get into school depends on what we do today. The heroes on the front lines of this crisis have gone without taking off their masks every single day, all day long. The nurses and doctors and child care workers and grocery store workers and utility workers. We owe it to them to do our part by simply wearing a mask when we're in public places, when we're out and about and there are crowds, when we're outside even. Even the president has started wearing a mask, and I'm grateful for that. That's why I wanted to highlight that. Wearing a mask can significantly help our economy. A study conducted by Goldman Sachs concluded that a federal mask mandate, that's if everyone in the nation had a mandate like we have in Michigan, like they adopted in Alabama today, if everyone had that, we could save the U.S. economy from taking a 5% hit to our GDP. That's massive. So if Michiganders don't mask up when we're going out in public, cases could rise and we could be forced to close down more of our businesses, including auto manufacturing plants that employ thousands of Michigan workers, jobs that our whole economy depends on. I've said it many times before, but a second wave of this virus could be absolutely devastating. So we can lower the chance of that second wave, or the breadth of it, or the intensity of it, by simply wearing a mask now. So speaking of small businesses, Mark Burton is here today to talk about the Michigan Small Business Restart Program. While businesses are reopening, the impacts of COVID-19 are still creating incredibly difficult situations for small business to overcome, from lost business and revenue to increased costs associated with providing adequate safety measures for employees and customers. And that's why I signed into law the bipartisan supplemental budget that directed $100 million of Federal CARES Act dollars to the Michigan Strategic Fund to implement the Michigan Small Business Restart Program. Now, these grants, up to $20,000 each, will support Michigan's small businesses and nonprofits that are reopening but have experienced a loss of income as a result of this crisis. As of this morning, small businesses and nonprofits can submit their application for restart grants through a single statewide application at michiganbusiness.org/restart. There will be a 3-week application window, and then all applications will be provided to the 15 local economic development partners that will administer the grants for a particular region. As we work to continue to ensure COVID-19 relief resources are benefiting all small businesses in the state equitably, 30% of grants awarded under this will be going to minority-owned and women-owned or veteran-owned businesses. We know helping these businesses thrive is critical to bringing more economic prosperity overall to populations that often remain underserved. The Michigan Agricultural Safety Grant Program application also went live this morning at michiganbusiness.org/ag-safety. This $15 million grant program will help our farmers and food processors in the state access PPE, testing equipment, training for workers, and housing solutions to ensure social distancing to protect our workers and the food supply here in Michigan. Together, these two programs put federal funding to work for small businesses in Michigan, the businesses that have been hardest hit by COVID-19, helping ensure that they can keep their doors open and put critical protections in place for their workers and their customers. Families across the state depend on Small Business Restart Program, particularly by building on families across the state depend on small businesses for their livelihoods. The Michigan Small Business Restart Program particularly will build on additional COVID-19 business relief efforts through the MEDC to create a strong foundation for Michigan's long-term economic recovery. So I appreciate the speed with which the MEDC was able to execute these programs to ensure that dollars could start getting into the hands of small businesses as soon as possible. In just 2 weeks, both the Restart grants and the Ag Safety grants went from words on a page to 2 fully operational programs accepting applications now. This is the urgency and know-how that we are approaching all economic recovery efforts with in this state through the leadership of the MEDC in coordination with other key state agencies. So I know that people are anxious to return to normal, especially where our economy is concerned. The reality is that true, lasting economic recovery is only possible through public health recovery. That means we need everyone to do their part, to continue following guidelines driven by science and mask up. This is going to be a team effort, but Michiganders know how to get things done. We have pushed a curve down before. We have led the nation. We are capable of this. If everyone does their part, we will be successful. I know we can continue to lead this nation, but we got to mask up to do it. And with that, I'll introduce the Lieutenant Governor Garland Gilchrist.
Thank you, Governor. And I also want to acknowledge Dr. Jonette Caldoun and Mark Burton, who are here joining us for remarks here in a few moments. You know, when we see the daily cases of coronavirus and the deaths that we're seeing compared to other states like Texas and Florida, it's easy to think that even while Michigan is experiencing an uptick, that, you know, we're doing okay, that we're out of the woods. But we're not. I talked about earlier, I've lost 23 people to COVID-19. These are real people. These are people who have stories, they have families, they have legacies that they were building that were cut short. It is long overdue that we do something about it. And these are people like, you know, an assistant pastor at the church that I grew up in, you know, a cousin down south who was the oldest living member of my family on my father's side, a Michigan legislator, talking about Representative Isaac Robinson, and others. I think the governor said it really well last week when she said, like, I don't care what's on your mask. You can wear a mask that says, I hate wearing masks. I just care that it's on your face. We need everybody to step up. Wear a mask. Wear a homemade mask. Wear a mask with a pattern. Wear a mask that reminds people of the greatest university in the history of the world.
I am.
Wear a mask for the other school. You know, everyone needs to step up. I mean, to use an analogy, we strap a piece of cloth across our chest when we get in a car to prevent loss of life. Now, All we're saying is that if you strap a piece of cloth across your face, you can prevent people getting sick and people losing their lives. You know, most of the times when I speak, you hear me using a phrase, stand tall. Stand tall for Michigan. Stand tall for whatever I'm talking about. I don't say that just because I'm 6'8", even though Coach Izzo told me I was 7 feet, which I'm going to feel great about for a really long time. It is a reminder. Stand tall means to be proud of doing the right thing. We can all stand tall and do the right thing for our friends, our family members, our neighbors, our co-workers, and our communities when we mask up for the state of Michigan. So let's all stand tall and do that together. With that, I'd like to welcome here to the podium Dr. Jonay Calderon.
All right, so go blue. Thank you, Governor, Lieutenant Governor. So today we announced 71,197 cases of COVID-19 and a total of 6,085 deaths here in the state of Michigan. We had 891 additional cases that were reported today. So that's very concerning. Overall, over the past few weeks, we've seen increases in cases across the entire state, which again is very concerning. But each region looks a little bit different. I'm going to talk a little bit about that. The Grand Rapids region has our highest rate of cases at 53 new cases per million people per day. The Kalamazoo and Detroit regions both have over 30 cases per million people per day. Saginaw, Jackson, Lansing, and the Upper Peninsula have over 20 cases per million people per day. And for the Upper Peninsula, cases have been rising for 6 weeks, and this is the highest rate that they've had during the entire outbreak. Traverse City also has over 15 cases per million people per day, with cases steadily rising over the past 3 weeks. Overall, and this is good news, we have significantly increased our testing numbers to over 21,000 tests per day over the past week, and this continues to steadily increase. What's concerning, however, is that as we are increasing our testing, the percent of those tests that are coming back positive is also increasing, and that number is now up to 3.4%. That is up from 2.8% the previous week. 3% is the cutoff that a lot of national experts say is where you really want to be under. So this is an indicator that there is ongoing spread of the disease and that we are not simply seeing more cases just because we are doing increased testing. So we're seeing outbreaks in multiple settings, including bars, churches, offices, gyms, long-term care facilities, weddings, family dinners, parties. People are gathering. What we also know is that there are many cases where we do not know the source of the spread. And this is really important. This means that it is spreading in the community, and that's even more importantly why we should all be wearing our masks. The age distribution for cases has also changed. So now the group with the highest rate of new cases is the 20 to 29 age group, and that is followed by the 30 to 39-year-old age group. So this is a really important point. Young people have to understand that they are not immune to this disease. Young people can get very sick from this disease, they can be hospitalized, and they can even die. Even if someone no longer needs to be in the hospital, there are possible long-term health impacts from COVID-19, many of which are still unknown. People can have persistent lung damage. We're seeing studies and reports of possible long-term brain damage and psychiatric challenges as a result of COVID-19 infection. And even if you don't get very ill from the disease, think about the people that you can spread it to. People with underlying medical conditions, those who are older, people who could easily lose their lives. We know of families that have lost multiple people across generations because of COVID-19. So regardless of how old you are, do the right thing, not just for yourself, but for the people in your household, your family, and your community. No one knows how this disease could impact them. So just do everything you can to not get it. Wear your mask, wash your hands, and do not participate in large gatherings. It's very simple. So the increasing numbers we're seeing across the state also shows the critical need for testing and contact tracing, which we've talked a lot about and which we continue to ramp up here in Michigan. We've continued to see a steady increase in testing over the last week, and we're moving closer to our goal of 30,000 tests per day. So testing is central to our ability to be able to contain COVID-19. So I urge everyone, again, please get tested if you're working outside the home. If you feel sick or if you've been close to someone who's been diagnosed with COVID-19 or they're having symptoms, you should get tested. The state has over 300 testing sites that are available. Many of them are also no cost. You can find a test site at michigan.gov/coronavirus test. We've also partnered with 211, so you can call them to get assistance in locating a testing site. We're also continuing to make good progress with our contact tracing. Our goal is to reach at least 90% of people within 48 hours of a positive test. However, unfortunately, we are completing over 70% of those interviews within that time frame. And so we are continuing to have challenges with people not answering their phones when public health staff call. Please pick up the phone if you see a call from your local health department. We're also seeing that in about a third of cases, people who test positive for the disease are not giving public health staff the information about their close contacts, even if they do pick up the phone. So we understand that individuals may feel uncomfortable about giving out names and contact information of their friends and family. We understand that. But please know that we do not share this information with anyone. But we will try to contact these individuals to make sure they know that they should quarantine and potentially get tested themselves. So this case investigation and contact tracing work is so important if we're going to be able to successfully slow the spread of the disease in our state. The state's also pushed millions of dollars out in funding to our local health departments so that we can hire additional case investigators and contact tracers for the fall. This will be incredibly important as we prepare for potential second surge. We don't expect there to be a widely available vaccine for COVID-19 for several months. We all know there is no antiviral treatment. So the most important thing, and really the only thing we can do to prevent spread of the disease, is to not come in contact with the virus in the first place. This means basic public health practices like washing hands, maintaining 6 feet of distance between you and other people, and wearing masks. And let me talk a little bit more about masks and why they're so important. So COVID-19 is spread, it's a virus. It's spread through droplets, through the air, and they spread when people are doing simple things like coughing, sneezing, yelling, talking, or just simply breathing. Those droplets travel through the air. They can land on your face or in your mouth, your nose, your eyes. And once that happens, that's how people get infected. This is not a new concept. Okay, healthcare workers have been using masks to prevent all kinds of respiratory diseases for quite a long time. Masks work. A simple cloth face covering can reduce the chance of spreading the virus by about 70%. We've heard that talked about today. So I just want everyone to know this is not a joke. It is not a hoax. This is not about politics. Just wear your mask because you want to live and you want to protect those around you. It's one easy action that makes us all safer. I know it's been hard. For more than 4 months, everyone's lives have been completely changed. We can't do some of the things that we were doing before. But we can get through this together, and we will. And it will be so much easier, and fewer people will lose their lives if we are all patient and band together to fight this disease. So thank you, and I'll turn it over to Mark Burton.
Thank you, Governor, Lieutenant Governor, Dr. J. Good afternoon, everybody. Following the outbreak of COVID-19, small businesses have faced significant economic impacts, including challenges with cash flow and resources needed to support their employees. At the same time, communities around the state have realized once again just how vital small businesses are to their economic health and livelihoods. Michigan's food and agricultural industry has also been hard hit by the outbreak and finds itself in need of additional support as Michigan farms and agricultural processors work to keep their employees and the state's food supply safe from the virus. It could not be more clear that the Michigan Small Business Restart Grant Program and the Michigan Agricultural Safety Grant Program, which as of 9 a.m. this morning are now both accepting applications at michiganbusiness.org, are more important than ever for Michigan to address the impacts of the ongoing pandemic here in our state. MEDC is in a position to start getting $115 million in federal funds into the hands of businesses, nonprofits, and farms across the state just 2 weeks after being signed into law by the governor, providing a crucial infusion of capital to support the path to economic recovery in our state. The $100 million for Restart grants are up to $20,000 each and will provide small businesses and nonprofits working capital to support payroll expenses, rent, mortgage payments, and similar expenses. To make it as simple as possible, there is a single statewide application at michiganbusiness.org. All application reviews and grant disbursements will be administered by 15 local economic development organization partners covering all 83 counties to ensure local priorities and needs are taken into account. Decisions on Restart grant awards will be made after the application period closes on August 5th, and it is important to note that this program is not a first-come, first-serve situation. MEDC is also proud to be working with our partners at the Department of Agriculture and Rural Development and at Greenstone Farm Credit Services to get $15 million in federal CARES Act funds into the hands of farms and food processors to support critical costs around COVID testing, PPE, employee training, improved sanitation, and temporary housing issues. With these 2 additional grant programs authorized just last week, the MEDC team has now deployed 17 different COVID response programs in just 4 months. These programs have directly supported more than 3,400 Michigan companies across all 83 counties, helped retain nearly 15,000 jobs for Michigan workers, and facilitated the production of more than 5.5 million units of PPE and other critical supplies right here in Michigan. We have also made it a focus to ensure recovery efforts focus on economic opportunities for all businesses throughout Michigan. To date, 42% of relief efforts deployed by the MEDC have gone to disadvantaged areas across the state. And we will also be working closely with partners to meet statutory requirements that 30% of the Restart grant funds be allocated to women, minority, and/or veteran-owned businesses. Targeted relief programs like these provide a crucial lifeline to help our small businesses, communities, entrepreneurs, and workers weather the immediate crisis. In the meantime, our team at the MEDC, who have worked so hard, so quickly to bring these programs to life, continue to focus on creating a long-term runway for economic recovery by growing businesses and resilient, diverse, and vibrant communities long after this crisis concludes. Once again, detailed information and applications for both programs are available at michiganbusiness.org, and we encourage business owners, farmers, entrepreneurs, and others who may qualify for these resources to visit the site to learn more today. And finally, the best way to help with economic recovery across the state is to mask up, practice social distancing, and follow directives. The only way we can ensure full economic recovery is to mitigate this threat to public health. Thank you again.
All right. Thank you, Director. Thank you, Dr. J, Lieutenant Governor. With that, I am happy to open it up for a few questions.
Governor, can you talk about so many parents at home wondering about school in the fall, the metrics you're going to use, and what a deadline would be for them to expect a decision as to whether schools can actually open?
So, as you'll recall, with the council's recommendation and the executive order that reflected the work that they did, we have articulated a number of things for different phases of the My Safe Start re-engagement. School boards are to have plans for Phase 3, Phase 4, and Phase 5, depending on what phase a particular region is in. For instance, currently right now, if you're a school board in the UP, there are a number of recommendations. There are some requirements, but largely there's quite a bit of discretion that the school boards have to determine what school is going to look like. If you're in Phase 4, which is 6 out of 8 regions in the state, there are a lot more things that are required to be in that plan, but still it is incumbent on the school board to come up with a Phase 3 plan, Phase 4 plan, Phase 5 plan. The troubling thing about the numbers of where we are now, how many cases today, Dr. J? About 900? Almost 900 cases today. It's the largest number we've had since May 14th, all right? So that's the trajectory that we're currently on. That's why masking up is so important right now. We are trying to hold on to staying in Phase 4. But if that trajectory continues and we have to move some regions back to Phase 3, that means there will not be in-person instruction, and the school board plans about how they're going to deliver remote education are going to be utilized. And so what I can tell you is that if the numbers keep going where they're going, it's going to be very problematic, and we may very likely have to take some steps backwards. What I can't tell you is what are people going to do between now and that 55 days. If the majority of us mask up, if all of us mask up, every kid will be in school this fall. If everyone masks up, we're going to see our numbers plummet and our economy is going to get stronger. If everyone masks up, we'll move the whole state into Phase 5 and re-engage in a way that will be the envy of every other state in the nation. Now, if some of us mask up, well, we're going to watch the numbers and see where our caseloads go. But as we know, that the critical numbers we've been watching are the fact that we've increased our testing, which is something that is a great tribute to Dr. J and our health department doing incredible work. Our percent of positive cases in those tests that are being done, the number of hospitalizations. We know that's a lagging indicator, but still it is something that we watch closely. So these are all factors. When will we have to make a decision so schools know which way it's going? It's going to be a lot closer to that start date, because I'm hopeful that in the coming weeks we're going to see these numbers go down, and perhaps we can solidify at least Phase 4, maybe even re-engage more things in our economy. But it all depends on mask wearing, Rod, and that's why it's so difficult to give you a hard and fast date and a hard and fast number. We're watching the trends. I'm listening to our public health expertise, and we're hopeful, but we're going to do everything we can to tighten up now so we don't have to take steps backward. Did you want to add anything, Dr. J? You're good? Okay. All right.
Yes. Governor Whitmer, a day into this mask mandate led to a tragedy and then another incident of a stabbing up north. Does that alarm you, and what can be done to protect employees who try to enforce this mask wearing when it's being seen as so contentious?
So let me start with this. You know, we're asking people to do a simple act of wearing a piece of cloth on their face, all right? It shouldn't be political. It shouldn't be about rivalries. It shouldn't be about anything other than doing what we need to do to keep ourselves safe, our families safe, and our communities safe, all right? I've given the economic reasons for masking up. I've given the health reasons for masking up. It's the simple act of wearing a piece of cloth on your face when you're in a public space or when you're outside but in a crowded space. That's it. This should not be this flashpoint that it seems to be. I'm incredibly sad about the tragedy that happened in Eaton County. I'm incredibly sad about the reaction that some have had. The majority of people are doing the right thing, and I'm proud and grateful for that. I am grateful that this 70-something-year-old man stepped in to support a clerk who was asking a patron to just mask up. I cannot ever pretend that I understand someone that would become murderous over wearing a piece of cloth on your face. But what I can say is that violence is never the solution. We can disagree on a lot of things, but we all have to recognize that this is one simple act for the greater good, for our individual good, that will make a huge difference. I can tell you right now that the people of Florida are in the midst of what is the worst experience with COVID-19, and that could be us in a matter of weeks if we don't take this seriously right now. So I ask people to show some kindness, some understanding, extend a little grace to one another, and just wear that mask when you're out and about. That's it.
Governor, your executive order on Friday did have the $500 fine penalty associated with that. When you were considering that, contemplating that, did you talk with local police departments, local sheriffs? What were your expectations for their enforcement? And since several of them have said we're not going to enforce it on various levels, what's your plan B?
Listen, plan B is people don't wear masks and we end up having to take steps back in the economy. That's what we're trying to accomplish. Listen, we've never anticipated that a lot of people are going to get arrested and pay fines, and this is not about being punitive. This is about recognizing this is a duty that each of us should undertake. We have laws, we have rules, no shoes, no shirt, no service. Now it's just no shoes, no shirt, no mask, no service. It's just one more thing that we can do, that we must do to keep people safe. If the state of Alabama today is issuing an ordinance or issuing an executive order just like the one that I signed, this tells you it's not a partisan issue. This isn't about anything other than trying to get our arms around a virus that does not care who you are, that travels because you're traveling. So when you're out and about traveling, wear the mask. Now, as regard to sheriffs and local law enforcement, we do have an ongoing dialogue. I know we've got some calls set up for this week, and I think that that's important. I'm hopeful that sheriffs will recognize that wearing a mask can save lives in their community. I know it's hard. I know that resources are limited, but this has never been about punishing anyone. It's about all of us stepping up and doing the right thing to do to protect ourselves and our families and our communities and our economy and the frontline workers. So let's take the politics out of this. Let's recognize we're all on the same team. You know, there are some examples of sheriffs who are doing the right thing. You know, Sheriff in Kalamazoo County, Richard Fuller, has issued a statement saying that, you know, they're expecting businesses to step up and keep their patrons and workforce safe through mask enforcement. Benny Napoleon in Wayne County has given orders. I think, you know, sheriffs in Oakland, Bay, Marquette, Muskegon, Kent, Washington, we got a lot of leadership in this state who wants us to be successful on this. And that's why it's my hope that all law enforcement officers are going to wear their masks and ensure that everyone in the community is safe. They've sworn an oath to uphold the law, and right now the law is that everyone's got to mask up.
Governor, you mentioned several times there's 55 days until the scheduled post-Labor Day start of school. But of course, as you know, many districts start earlier, sometimes much earlier, some scheduled for mid to late August to start. Are you considering an order or rule that pushes everyone to after Labor Day to buy more time? Or can districts expect to be able to start more or less when they want?
So I think that's a great question, Zach. Candidly, we've not had a conversation about whether or not to order a specific start date. In the school order, it was really giving school boards some discretion, permitting actually them to start earlier if they wanted to. You know, at this juncture with the way that our numbers are going, I do know that we are all having a lot of conversation about where we might want to land, and so I think you've asked a really good question, but at this point there's not a solid, you know, perfect answer for you. But we're looking very closely at what is going on across the country and around the world. There are countries that have resumed school. Their kids are in masks and face shields. Little kids, they're doing it. They're re-engaged, but re-engagement is dependent on the numbers going down. That's where success has been had in the re-engagement of schools, where COVID numbers are going down. We're not in that position right now, and that's what's so concerning. That's why I'm not counting down to the first day of school because I want to get my kids out of the house, but every parent knows when that first day of school is, because we know it's important that they get back in classroom. That's where the best, you know, kind of education can happen. So that's the goal here.
We'll take just a couple more. Okay.
Now, today we saw almost 900 cases. That number has gone up and down over the last few weeks, going up. but deaths have stayed pretty low. Is that because we're doing a better job of treating these cases, or are we finding more asymptomatic people? Why are they separating them?
I appreciate that you pretended that was for me, but you know it's for Dr. Khaldun. I'll ask her to come on.
We just talked yesterday. You didn't ask me, but so no, that's a great question. So what's different now compared to March and April is we have a lot more testing availability. So in the very beginning, we were testing people who were really only in the hospital, which is unfortunate, but that's the number of tests that we had. So now what we're seeing is there's more and more tests, and as I said, we're also seeing people who are younger. So 20 to 29 is the age group that has the highest number of new cases. That age group tends to be a little bit healthier, and so right now we're not seeing the hospitalizations and the deaths go up. But again, that also tends to be a lagging indicator. So first, you get sick, you get your test, and then you fight the disease, and we see what happens then. So I wouldn't get too complacent about the deaths, and we're closely watching that as well as what's going on in other states.
I'm only one from you mentioned the importance of testing as an overall part of the strategy. It's my understanding there's still things that must qualify someone for testing. Are we approaching the point where people can get tested for no reason? And how do you expect that to open up some of the data you're seeing?
So that's a great question. So we, over at least 6 weeks ago, really significantly expanded. Anyone who wants a test really right now can get a test. We're testing in some communities just because they haven't seen enough testing done. And so those local health departments have particularly increased their testing. So again, if you're working outside your home, if you've got symptoms, if you've been exposed to someone, certainly there's some individuals who work in higher risk settings who are recommending, even mandating for nursing homes that they get tested on a regular basis. But right now, no one should be sitting at home thinking that they can't get a test. You can go to our website or call 211 and we can make that happen.
Thank you, Dr. J. Thanks, everybody. Thanks, everybody.
Are you going to lift the moratorium or let it expire on